The Africa Youth and Adolescents Network, AFRIAN, was launched during the 2005 Youth Pre-Conference of the Sahara Conference to increase meaningful youth participation in Africa's development. The main mission of the network is to create an enabling environment for the promotion of an effective participation of adolescents in response to the HIV epidemic, poverty, unemployment, gender-related inequalities and iniquities, promotion of sexual and reproductive health rights, and general youth development. In November 2016, the African Adolescent Network AFRIAN launched the campaign 90 Days of Consent in Zimbabwe, Botswana, Malawi, and Zambia. The campaign, which ran for 4 months, concentrated on access to HIV testing and counseling, access to contraception, ending child marriage, and participation in medical research. The locations were mapped by AFRIAN country chapters as areas with high HIV prevalence rates and adolescent fertility rates of more than 100 births per 1,000 adolescent girls that need such an intervention. The data collected was then used to gather the views of adolescents and young people on these issues. The objectives and aims of the project were to engage governments, parliamentarians, and youth-oriented civil society organizations in these countries to make legislative changes for the age of consent for sexual reproductive health services, to educate the public on the importance of a harmonized age of consent across East and Southern Africa, to encourage the review and harmonization of the age of consent to SRHR/HIV services, to raise awareness on adolescent HTC and SRHR, to develop a Sex Rights African Network mobile app that will be used to mobilize other young people to join the campaign and discussions, and lastly, ending child marriage. A series of activities were conducted by different teams in Zimbabwe, Malawi, Botswana, and Zambia, which involved various government ministries and other stakeholders of the #90 Age of Consent project. Each country's team met at shopping complexes, schools, partner organization buildings, and social events for social media mobilization through one-on-one and group mobilization to provide information and invite the people to join the campaign project through social networks. T-shirts and posters were printed in support of the campaign. All the programs in each country were successful in their own right to ensure adequate information was collected to ensure solid conclusions for age of consent advocacy. To achieve the aims the organization had set, the project was put into action by collecting data in various ways, which included Facebook, Twitter, bulk SMSing/texting, focus groups, digital confessions, online and offline surveys, and a sex rights website. The outcomes of the project were as follows. Communities welcomed the campaign and agreed that the information is important and there is need for more projects on a wider scale to reach more young people. There is a need to balance family values, the family nucleus, and ensure that young people are not allowed to have autonomy to some services until they're at a stage of maturity to understand the implications of their actions. A method mix approach in using new technologies, which are social media and text, for those with and without internet respectively, is effective in engaging adolescents and young people on SRHR issues. Education and awareness campaigns should be launched to engage young people, led by young people, and using multimedia. The project strengthened the network of young people working towards the Age of Consent Awareness and Education Initiative. This played a major role in demonstrating the urgency of young people in dealing with SRHR advocacy and response. The Age of Consent project also helped uncover the perceptions of communities on sexual health and HIV issues that can be used for effective legislature and law change advocacy.